Hi, my name is Jesus Moya, and today I'll be covering Parkinson's disease. PD is the second most common neurological disease with a prevalence of 1% among those over 60 years of age. PD is a chronic progressive degenerative neurological disease and is idiopathic. PD is characterized by dopaminergic neuron loss in the substantia nigra followed by dopamine depletion. The results in cardinal motor symptoms such as bradykinesia, postural instability, resting tremors, and rigidity. Age and gender affect the incidence of PD. PD is higher in males than females, and its incidence generally increases with age, especially after the age of 60. However, it stabilizes after 80 years of age. Generic predisposition might greatly modulate the association of environmental factors with PD. Environmental factors that increase PD include welding and exposure to heavy metals such as iron, magnesium, lead, and zinc. About 10% of PD cases are caused by generic factors. Mutations in the alpha-synuclein, pink, LRRK2, and other genes were seen to increase PD. Caffeine is inversely related, meaning caffeine intake has been seen to slow down the progression and onset of PD. PD is characterized by bradykinesia, rigidity, resting tremors, postural instability, and Parkinsonian gait. The characteristics of Parkinsonian gait include reduced walking velocity, shorter stride length, stooped posture, instability, and diminished left-right bilateral coordination compared to age-matched controls. Someone with PD might experience higher rates of anxiety, depression, mood swings, and have difficulty sleeping. Also, PD could affect your cognitive abilities. It can cause confusion, increase memory loss and dementia, and diminish focusing abilities. To classify the severity of PD, the Hoehn and Yahr staging scale can be utilized. In stage 1, the person will only experience symptoms on one side of his body. However, in stage 5, the patient is now wheelchair-bound or bedridden. There is no cure for PD, but it can be slowed down using levodopa combined with carbidopa. Carbidopa delays the conversion of levodopa into dopamine until it reaches the brain. Nerve cells can use levodopa to make dopamine and replenish the brain's low supply of dopamine. The low levels of dopamine is a huge issue, and medicines like bromocriptine, pramipexole, and ropinirole are utilized to replace dopamine in the brain. They mimic dopamine's role. Gait impairment, postural instabilities, and falls can lead to an increase in risk in mortality and morbidity in patients with Parkinson's. Aquatic and physical therapy can help address these issues. Recent evidence suggests that music-based movements may be a promising intervention to improve gait and gait-related activities in Parkinson's disease patients, because it naturally combines cognitive movement strategies, cueing techniques, balance exercises, and physical activity while focusing on the enjoyment of moving to the music instead of the current mobility limitations of the patient. Speech therapy can also be utilized. Based on the research, there was no one-based program that someone with PD could follow. Due to the wide range of symptoms and severities, most exercise programs were tailored to each individual. Some programs included 60 minutes of resistance training, 60 to 15 minutes of cardiovascular training, balancing exercises, and stretching. They all help maintain the quality of life of the patient. To slow down PD, exercise interventions should be used in conjunction with PD medication. The optimal form of exercise intensity is not yet clear. Low intensity and high intensity adapted exercise programs improve balance and mobility in patients with PD. Also, a variety of activities is suggested.